Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. On this episode, open wide for a bonus round of dental insights.
Hey, Steve, you up for trying something new?
Depends, Don, if the change is jaw-dropping.
Love those puns. Well, good. We're about to sink our teeth into something different. A special bonus episode of Rumor versus Truth right here, right now.
Right, in our last episode, Dental Dilemmas, we brought in Dr. Jayson Chalmers, DDS, as our dental expert for two of our claims.
Yeah, if you missed that episode, don't brush it off. Start there, then come back for this deeper dive. To get all that great content, I recorded a longer video with Dr. Chalmers. A lot of excellent material didn't fit into the main show.
Yeah, this extended cut drills even deeper on fluoride into the history, chemistry, dosing, and what the latest evidence is really saying. And we found it fascinating and think you will too.
Yep. And just a heads up, since this episode isn't one of our regular episodes, there is no CE credit available. CE will be back with our next full episode on cold and flu remedies on November 18th.
Looking forward to it. So without further ado, here's our extended interview with Dr. Jayson Chalmers, DDS, on the history, efficacy, and importance of fluoride in dentistry.
Okay, so for this claim we have here that fluoride toothpastes and mouthwashes are harmful, we have an expert with us today, Dr. Chalmers. So, Dr. Chalmers, what do you think about this claim about the harmful
Well,
link
first,
to
hi,
fluoride?
Don. Thanks, sir, for having me here.
Yeah.
The claim that it's harmful, some new research came out in the last year. There was a meta-analysis of, I believe it was 74 studies around the world, looking for some link between fluoride and it harming people in some way. The meta-analysis came back that there was a link. I think a lot in the news lately has been correlation versus causality, and this is one of those that's been a
Uh-huh.
lot in the news. So this is one of those things as well. Like, yes, there is a link somehow between elevated fluoride levels in drinking
Mhm.
water and a slight dip in IQ points, basically, and that
Okay.
came out in this meta-analysis. How accurate it is, how is to be determined. I was doing kind of a deep dive into this part of it with the NIH, and of the 74 studies, I believe it was close to 50 were flawed or biased in some way. So that
Oh,
takes
wow.
a large chunk of that
Yeah.
out. So if you look at that, now we're dealing with 20 studies, not as many people.
Mhm.
Also, it was hard to judge the studies um, because they were taking mostly groundwater, which
Mhm.
not additive fluoride, but fluoride naturally found in water, and that's what most of the studies. And those are unregulated numbers of amounts of fluoride there in the water, so it's
Mhm.
hard to judge how much fluoride was the issue, right? And is the fluoride
Right.
is it directly correlated to this as a neurotoxin, right? Um, so it is difficult to determine that, but it is an interesting study, and it brings up some really good points that so we do
Mhm.
need to be cautious with how much is in the water, how much are we getting, how much is beneficial, how much is harmful.
Mhm.
And
Mhm.
so it does bring up those, which are good conversations to have, I think. So
Definitely. Definitely.
I kind of went through a deep history of fluoride too. So if you want to go back 120 years with me, we can start talking about
Sure.
like
Let's jump on that
fluoride.
time machine. Yeah.
What? Yeah, it was
Yeah.
interesting. It was a young dentist just out of school from the East Coast, traveled to Colorado Springs. He started his dental practice there. He saw this whole population of kids, adults with these really mottled brown, white, yellow spotted teeth. Very few
Mhm.
cavities, though. Very few cavities, but
Oh.
discolored teeth, like grossly discolored, like where it was obvious. He even described it as a chocolate brown teeth, that the teeth looked like they were made of chocolate, you know? So that discolored. And so he works with another young dentist, a person by the name of G.V. Black, who is famous in dental circles. He is the father of modern dentistry, came up with how we prep our fillings, how we do these things. And now that's a little bit older now. Those are the silver fillings that we're talking about. He kind of came up
Mhm.
with the design and prep for those. So GV Black and Dr. McKay worked together to kind of figure out what's going on here. Where's it coming from? What's in the environment? What's happening? Dr. McKay searched for 30 years before they actually found it was fluoride in the water that was causing this. So they worked in Colorado, they worked in part of Idaho, had this issue as well. And then in Arkansas, around the Alcoa aluminum plant, a bunch of
Mhm.
people had problems with the same thing. And it was realized it was fluoride as a byproduct of aluminum manufacturing that was getting in the water and staining their teeth. And Alcoa was the group that finally was able to find it was fluoride. Dr. McKay didn't have the equipment, the knowledge to isolate the fluoride ion,
Mhm.
but Alcoa did. So Alcoa,
Okay.
he knew there was something. He knew it was related to the water, but he just didn't know what it was. It took 30 years to figure it out into the 1930s. Um, in 1945, Grand Rapids, Michigan ended up with their first trial of fluoride, adding it to the water. They
Mhm.
realized that anywhere about one of milligram per liter was about the right level where it wouldn't stain the
Mm.
teeth, you wouldn't get the discoloration, but you would get the beneficial effects of fluoride. Now we talk
Oh.
about the beneficial effects. What is that, right?
Mhm.
The tooth is made up of hydroxyapatite. That's the main building block of it. That's a
Mhm.
protein that the tooth is made of, or mineral that the tooth is made of, rather. So it's made of hydroxyapatite. Acids break it down. Acids in our,
Mm.
if you drink a sparkling water that's got citric acid in it, that's going to break down the tooth a little bit. If you eat sugar, the bacteria create acids which break down the tooth a little bit. So over decades or years, that acid breakdown causes demineralization of the hydroxyapatite. So what fluoride does is it kind of
Mhm.
comes in, attaches itself to the hydroxyapatite, and it becomes a new mineral called fluorapatite. Now,
Okay.
fluorapatite is much harder to break down than hydroxyapatite. So the
Mhm.
acids in the mouth, in our drinks, in our food, created by the bacteria, they just can't seem as easily to pull off that fluoride off the fluorapatite. So the
Hmm.
mineral remains intact, and that's how fluoride helps. That's one of the ways the fluoride helps.
Okay.
Other ways, when we ingest it in the water, when we have the under, 1 milligram per liter amount in our water, it doesn't stain our teeth, it
Mhm.
doesn't affect our bones. It's harder to break down basically the
Sure.
fluorapatite.
Sure.
So we can have more acid, you can have more of this, and the tooth stays healthy. But it's a very fine line in the amount of fluoride, and this is where I think this debate is coming into effect. How much fluoride are we supposed to have? I think most people in the industry realize that fluoride, there's a benefit to fluoride, but how
Mhm.
much, right?
Yeah.
So as of October 31st this year, they're gonna, I think, eliminate these high additive prescription types of fluoride. We would have known them when we were kids as those little they look like a Flintstone tablet, like a little almost candy kind
Mhm.
of thing that you chew on,
Right.
and your parents would give it to the kids, and that's going to be kind of going by the wayside, I believe,
Mhm.
with the new guidelines. And I think for the most part, most dentists, at least in the circles I run in, they haven't been prescribing that for a couple decades anyway. Like that's kind of been out of
Right.
favor. I can't remember the last time I prescribed fluoride tablets to somebody.
I haven't seen it in 20 years myself, so
It's
yeah.
yeah, it's been
Yeah.
forever, right?
Yeah.
And so now we kind of just tell parents with their kids, like, yeah, flavor the toothbrush with a little bit of
Mm.
toothpaste, brush their teeth. Young
Sure.
children can't, they don't have the dexterity yet in the mouth to spit it out. They're going to swallow a
Mhm.
little bit of it. A little swallowing of toothpaste is not harmful. You're not gonna, you have to, a little kid would have to eat half a tube of toothpaste for it to be toxic,
Okay.
right? So our recommendation is to make sure that the toothpaste is out of reach for the children, that the parents
Sure.
are the ones kind of controlling it, right?
Mhm.
And then it should be fine and very safe. It's a very safe,
Mhm.
effective product, a very inexpensive product for what it does, like the benefit you
Mhm.
get and the price for the benefit. Oh my gosh. I mean,
Mhm.
you can't get a much better benefit. I think it's under $1 per person in the United States to fluoridate the community water.
Wow.
That's cheap.
Cheap, yeah.
That is
Mhm.
really cheap.
Agree.
Um,
I agree.
so and what it saves you on the back end, they're,
Mhm.
to give you an idea, Calgary, Canada, got rid of their fluoride. I think it was, I wanna say it was 2011, they removed
Mhm.
fluoridation. It was getting too expensive. They were gonna have to,
Sure.
kinda refurbish their fluoridation system, and it was gonna be millions of dollars, and they were like, "Ah, we just can't afford it right now." So they
Mhm.
eliminated fluoride from their community water systems. Uh, just a few years later, they added it right back in because so what they
Mhm.
were saying really obviously was the price of dentistry go through the roof in that area. All of a sudden,
Mm.
everybody started getting cavities, and they're like,
Right.
"Oh my gosh, it's more expensive to treat the cavities than it is to put the fluoride back." So they ended up putting the fluoride back in the water. They spent the millions of dollars. They put the fluoride back in the water, and they're going to see over time those cavities go away, and it'll be cheaper for the community and healthier for the community.
Right.
I think one of the things people don't realize is like let's say you're a young child, you're 3 years old, you get a cavity for the first time. That's not a real cooperative child. Usually, 3-year-old child
Mhm.
in the dental chair is not your best patient, right? So
No.
we often have to sedate these patients. And now
Mhm.
there are risks with sedation, right? The
Mhm.
risks go up incredibly. So here you have a young child with a small cavity, and in some cases, you're having to do general anesthesia on this child to fix small things.
Right, right.
That the risk is huge there. I mean,
Um,
so the risk of a little bit of fluoride, versus
uh-huh.
possibly general anesthesia and fixing, I mean, it's a no-brainer, right? So the
Right, right,
benefits far outweigh the risks here. So,
right.
um, in Grand Rapids, I'm going to go back to Grand Rapids real quick. So they added
Mhm.
the fluoride in 1945 to Grand Rapids.
Mhm.
It was supposed to be, I think, a 15-year study originally for this, ended up being about
Okay.
30 years altogether. Um, it was a 60% reduction in the number of cavities from adding fluoride in
Oh,
Grand Rapids. 60%. Okay. Now, this was at a
wow.
time when fluoridated toothpaste weren't really that common. You weren't
Mhm.
seeing fluoridation in other parts of your life, right? You were just getting it through the water that you drank. So, of course, there was a big up to 60% is massive. That's huge, right?
No.
Nowadays, we see about a 25% reduction in cavities with community fluoridated water, right?
Okay.
So
Okay.
we're not seeing the 60% that they saw in the 1940s. We're seeing about a
Mhm.
25% drop. There was two studies recently, one in 2022 in the UK, one in 2016 in Australia. Both of
Mhm.
them saw with infants a 35% drop in cavities.
Okay.
So still very effective, very helpful, and 35% drop, that's huge.
That's yeah, I was that's
That's
pretty good.
massive, right? So we still see to this day massive benefits in low levels of fluoridation in the water under 1 milligram per liter. So
Okay.
in our industry, that's kind of what we're sticking with. Is we're sticking with about
Good.
that level or less. Some places in Asia have up to 30 milligrams per liter, so they have to defluorinate their water. They have to like recycle it and get all that out of it, right?
Mhm.
Um, so some places add, some places take away, right?
Okay.
But trying to get under one is where the sweet spot is.
I feel like I
Yeah,
got a master class in Florida alone. I appreciate it. I know our audience will appreciate it. I do love the point about keeping the toothpaste from children up and high
yeah.
away from because I accidentally used my daughter's toothpaste, which is like
Hmm.
a unicorn kind of flavor toothpaste, and it is tasty. So I could see how these kids can really like get into it and maybe consume more than they should be because
Oh,
of
for
just the
sure.
candy sugar factor of it. So
Yeah,
I
yeah.
do also do like that point of just storing that stuff up and away from kids when you can.
Absolutely.
Yeah,
Yeah, and the
appreciate it.
mouthwashes and everything else too. Although the mouthwash
Yeah.
have a little zing to them, so most kids won't go twice to that if they get a hold of it.
No. No.
But the toothpaste,
Yeah, definitely.
and then I don't know how old your kids are, but for young kids, they tend to do non-fluoridated toothpaste in the beginning,
Mm,
just to kind of get them used to the taste, the flavor, the
yeah.
process. And then later, as they get a little bit older and can manage to spit a little bit easier, then we kind of add
Mhm.
fluoridated toothpaste into the mix. So that's kind of
Right.
my
Yeah, I think it's one of those yeah, it's like a half strength Florida or something along those
right.
lines where it's
Yeah.
for kids.
Yeah.
Yeah. Yeah.
Now, something else we didn't
Yep.
really talk about yet are the prescription fluorides that are not just the tablets
Mhm.
that we give to the kids, but let's say, you're an at-risk patient, maybe you have a very dry mouth from medications that you're taking, or
Uh-huh.
just as we get
Mhm.
older, our mouth gets a little bit drier and we become more
Mhm.
susceptible to cavities. With many patients, we'll prescribe a high fluoride toothpaste. So
Mhm.
the toothpaste that you're probably using is about 900 parts per million. That's a
Mhm.
pretty standard Colgate, Crest, whatever other,
Mhm.
one you're using. That's about what they have. And then a
Mhm.
prescription toothpaste that your dentist is going to write a script for is going to be about 5,000 parts per million. So about 5 times what your standard or
Okay.
off the shelf, toothpaste is. Still super beneficial. Still don't want to swallow it. Still don't want to eat it. Don't
Mhm.
consume it. You use it, you spit it, you leave it. Right. But those I don't believe are being targeted at all with the changes
That's
coming
good
up
to know.
October
Yeah.
31st. I think those
Yeah.
are going to be just as they were prescription
Right.
based. So that's but it is a huge benefit too to that. So
Yeah.
yeah,
And that's where the 5,000 comes from with those brand name kind of toothpaste. Yeah. So it's something else good to know. So yeah, thank you for that. I do appreciate the master class in fluoride.
yeah.
Yeah.
Knowing that we were doing this, I'm like, I want to dive deep into this, and it's stuff that we've learned maybe 30 years ago in
Yeah.
dental school. But I'm like, I need to like
Yep.
refresh a little bit and remember
Yeah.
my history here.
Nice. I really liked that info on the history of fluoride there. Learned something new. And we hope you enjoyed this special bonus episode of Rumor versus Truth as well. We'd love to hear what you thought. Should we do more bonus interviews, try other experiments, or stick with the classic Rumor versus Truth format that you know and love? Let us know. Email us at rumorversustruth@trchealthcare.com or send us a text right from the show notes.
And a huge thank you to Dr. Chalmers for sharing such valuable insights and taking time to join us. And don't forget, there are plenty of goodies in the show notes, including that special 10% discount code, good on new and upgraded subscriptions. The code is RVT1025.
And mark your calendar. Our next full episode drops on our regular day, the third Tuesday of the month. We're going to tackle cold and flu claims with natural meds with another special guest expert, and it's sure to go viral in the best way.
Thanks for joining us on Rumor vs. Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths.